Hey everybody, we are New Vision from Baltimore, Maryland, and before we start, we want to take time to thank the Susan G. Komen Foundation and to the ambassador, Bishop William Murphy, for this opportunity to worship with you guys and to celebrate and to provide strength and encouragement for breast cancer survivors and for those who will survive, because we're speaking life into that situation for you. So we want you to understand, as you're watching this taping, as you're watching this recording, that we serve a God that can do anything but fail, because we serve a great God, and he's a healer, and he's awesome in power, and his power is never failing. Our God is a great God. Come on, let's sing it now. Can someone sing a new song to the Lord?
Yes, God.
Yeah. God, we serve you and we bless your name.
Hallelujah. We bless you,
Hallelujah. The songwriter wrote it just like this. It says, water you've turned into wine. Open the eyes of the blind. There's no one like you. There's none like you. And into the darkness you shine, and out of the ashes will rise. There's no one like you, Lord. There's no one like you. Come on, help me sing, y'all. Sing, our God is greater.
Our God is stronger. Lord, you are higher than any other.
Our God
is healer, awesome in power. Our God, our God.
Right here. We bless your name, Lord. Right here, everybody. Yes, Lord. Sing, water you turned into wine. Water you turned into
wine.
Open the eyes of the blind.
The eyes of the blind.
Come on, declare it. There is
no one like you.
There's no one like you, Lord.
None like you.
Into the darkness you shine.
Darkness you shine.
Out of the ashes we
Out
rise.
of the ashes we rise.
There's no one like you, Lord.
No one like you.
No one, no one, nowhere.
Like you.
Yeah, yeah. Our God is.
Our God is greater. Our God is strong.
God, you are higher.
Higher than any other. Our God is healer.
Awesome in power.
Awesome in power. Our God.
Our God.
Our God.
Hey, sing it. Our God is.
Our God is greater. Our God is stronger.
God, you are higher.
Higher than any other. Our God is healer.
Awesome in power, Lord.
Power. Our God.
Give it to her one more time. It feels good.
Our God.
Everybody sing, our God.
Our God is greater.
Yeah.
Stronger. Lord, you are higher than any other.
Our God is healer. He's awesome in power.
Power. Our God.
Our God. I'll bring it up right here. Oh, listen. And if our God is for us, then who could ever stop us? And if our God is with us, then what can stand against? And if our God is for us, then who could ever stop us? And if our God is with us, then what can stand? You say.
And if our God is for us, then who could ever stop us? And if our God is with us, then what can stand?
And if our God,
If our God is for us, then who could ever stop us? And if our God is with us, then what can stand?
And if our God,
If our God is for us, then who could ever stop us? And if our God is with us,
what can
then
stand?
stand?
And if our God is for us, yes, Lord,
Could ever stop us? And if our God
then what can?
then what can stand against?
Oh, what can stand
What
against?
can stand against?
Yeah, Lord, right here. Our God is greater.
Our God is greater. Our God is stronger. Lord, you are higher than any other.
Our God is healer. Awesome in power. Lord. Yes, He is. Oh, yes, He is. Our God. Oh, our God. Our God is healer. Yes, He is. Our God. One more time. Our God is. Yeah. Yeah. Our God is healer. Oh Lord, and if our God is for us, then who could ever stop us? And if our God is with us, if you believe it, then what can stand against you? And if our God is for us, no, who could ever stop us? No. And if our God is with us, hey, then what can stand against? Oh, and if our God, then who? Yeah.
God is with us, then what can stand against? And if our God is for us, then who could ever stop us? And if our God is with us, then what can stand against?
What can stand? What can stand against us? No.
What can stand against?
Whoa, no. 'Cause my God is greater. My God is stronger. God, you are higher than any other. Our God is healer. That needs to be stay there. Our God is healer. Our God is still healing. Our God is still healing. Yes, He is. So my God is greater. My God is stronger. God, you are higher than any other. Our God is healer. It's awesome in power. Our God. Hallelujah. Hallelujah, Jesus. And what can stand against us? Nothing can stand against us. 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 For God is before us. And if God is before us, then who can stop us?
Well, hello there. My name is William Murphy. It is such an honor to serve as this year's chair of the Worship in Pink Day. The Susan G. Komen Foundation is partnering with the faith community. They've got the facts and we have the faith. And I believe when you put it all together that God's going to get involved. It's Worship in Pink Day. We're laying it all on the altar. I'm excited about this day as we celebrate those who are still in the fight, as we remember those who transitioned because of this dis-ease. I remember some years ago when my mom, after fighting with breast cancer for 20 years, decided to take the upgrade. My mother was a woman of God, and she walked with God, and she served God. And so my conviction is that I didn't lose my mother to breast cancer, but my mother took the upgrade. And so today, as we worship in pink, we're going to lay all of that on the altar. I'm so grateful to the Susan G. Komen Foundation for establishing this day, understanding that fact always needs a little bit of faith. We're going to put it all on the altar today. Susan G. Komen. Just Y'all forgive me, I believe the G stands for God. If we can just get God in the middle of this, I believe he'll make it all better. He'll make it all right. We're excited today. It's the Worship in Pink Day. Get it on the altar. Get it off your chest. If we can get God in the middle of it, I promise you, he'll make it all right. It's already getting better. It's already getting easier. Listen to me. God's already moving on your behalf. It's Worship in Pink Day. Let's go.
Thank you, Bishop Murphy. We are so thankful that you are the chair of the Worship in Pink event this year. What an amazing story. We are all so inspired by you. My name is Katie Stone, and I'm the Vice President of Community Health for Susan G. Komen. I'm also an Atlantan, and I'm just pleased to be here to tell you more about the work that Komen is doing. But first, I thought I would tell you why I'm so passionate about this work. I just crossed the finish line for 10 years of survivorship with stage 3 breast cancer. And I've been involved with Komen, since the very beginning. And I've learned so much about how the investments Komen has made, not only in community health, but also in research, have made all the difference in my survivorship and in the survivorship of so many. I believe it, I feel it, I know it, and I just appreciate all of you helping us to do this work. I'd now like to tell you more about the work that Susan G. Komen does. There are 3 main pillars of our mission investments. The first is research. Every major advancement in breast cancer care and treatment since Komen was founded in the 1980s has had Komen funding behind it. We're very proud of how these research investments have allowed us to serve men and women with breast cancer all over the world. We also work on public policy and advocacy, talking to our legislators, both on the local, state, and national levels, to make sure that legislation is enacted that will help people where they live access care and get everything that they need to detect and survive the disease. And then on the community side, we're all about getting closer to the patient. We want to make sure that each person has uniquely what they need to beat the disease. We do everything from bringing people into the continuum of care by providing screening and diagnostic services. We do an awful lot of education, just talking to people so they can understand what their unique risks for breast cancer may be, and then talk to their doctor to make sure they're getting screened early and often, because we know an early diagnosis can result in much better breast cancer outcomes than a later diagnosis. We also have a breast care helpline where people can call and ask questions about breast care, get referrals for resources in their community. We have a patient navigation program, which means we have people right here in Atlanta and elsewhere that can hold someone's hand throughout the entire process. It's all about unique care for each individual person, because not everyone needs the same things. But if we're really going to end this disease forever, each person needs to have uniquely what they need to detect and survive this.
So this is William Murphy again. I just found out something that really just hit me in the chest. 1 out of 8 women, period, will be diagnosed with breast cancer. Here's the part that really hit home. Where I live here in Atlanta, 45% of the African American women who are diagnosed are more likely to die. This is crazy. Probably because 30% of those who are diagnosed late are in the African American community. Here's what I need you to do, sis. I need you to be aware. I need you to check your chest. I need you to get scanned. Do whatever you gotta do. And guess what? If you need help, the Susan G. Komen Foundation, we got you. Get screened, get tested. And those of you who are listening, and you know somebody who's been affected by this disease, make a donation. Do it today. I'm praying for you. We're gonna be all right.
During these times of a national and global pandemic, breast cancer patients need us even more than they needed us before. It's highlighted so many problems in our system that really impact a patient's ability to get the care and treatment that they need. We have a treatment assistance program that has been in existence for years, but it is so important now because this program allows patients currently in treatment to to call and get a financial support for co-pays or childcare or transportation or housing or utilities, any kind of financial expense that might get in their way of continuing their treatment, that's what the Treatment Assistance Program does. And the Treatment Assistance Program is available to people in Atlanta and all over the country, because where you live shouldn't determine whether you live. So we want to make sure that our services are available for every person, no matter where you are.
My name is Alicia Gibbs, and I am a 6-year breast cancer survivor. Back in June 11th, 2014, I remember my husband and I being in my doctor's office and waiting to hear the results from a biopsy. I had found a lump in my breast the month before and didn't know what that was. So my primary care physician, she said, let's do some investigation. So she sent me to a breast surgeon, and my breast surgeon, she did a biopsy and some other tests. When she came into that room, I can remember her coming in, have her head cocked to the side. And then I looked at her and I said, praise God, it's going to be okay. I think I was more of a comfort to her than I was to myself. She began to tell me, yes, Alicia, you do have breast cancer, stage 2B. I really felt numb, really numb. But I listened to what she had to say. But I'm so happy my husband was there, because even to this day, I don't remember all of it. I was really numb and kind of in shock. So she continued to talk to me. And then I remember saying to myself, Lord, I'm still grieving the loss of my son. He passed in 2011 from a brain aneurysm. He was age 13. And now you're giving me this to burden with? What's going on? But I can say, with my support from my family, support from wonderful organizations such as Susan G. Komen, I am pushing through with my rounds of radiation and also chemotherapy, and now I'm on a chemo pill. I have 5 more years to go. I made it through 5 years. I'm 5 more years in, and I'm so proud of myself. But God is a sustainer through this all, and without Him, I would not be here. I thank God for my support, my family support, my friends, and I really do thank God for seeing me through.
Good afternoon, everyone, or good morning. I am Dr. Anita Johnson, Chief of Surgery at Cancer Treatment Centers of America, and we're as well as the National Director of Breast Oncology for our enterprise. And today we're going to talk about some updates in breast cancer. So just a little bit about me. I've been a breast surgical oncologist for over 20 years. I am Chief of Surgery here, as well as I stated, the National Director for Breast Oncology. I finished from Spelman, Morehouse School of Medicine in the University of Arkansas. That's where I completed my breast fellowship. I sit on some national and local advisory boards. And I've done lots of events, including multimedia as well as radio. So just a little bit, we're going to go over screening guidelines, high-risk genetic testing guidelines, imaging, surgical options, and triple-negative breast cancer. So basically, in the United States has the highest rates of breast cancer, and so we lead in that area. The stats have not changed, but 1 in 8 women will develop breast cancer in their lifetime. For African American women, this number used to be 1 in 14, but now it is 1 in 8. It is projected by 2030, there will be a 50% increase in the diagnosis of breast cancer throughout the world. Women who are noted to be high risk can have up to an 80% chance of getting breast cancer in their lifetime. So some risk factors that we should go over: being overweight, increased alcohol consumption, full-term birth by the age of 30 will actually, and that's your first child at the age of 30, will increase your risk, as well as having a significant family history. So what we want to get from this is that the bottom line, when it comes to getting your mammograms done, we recommend that women start getting mammograms on an annual basis, starting at the age of 40. There are several recommendations, particularly for African American women. They should start at 40 because there's a certain percentage of African American women who present at a much younger age. So this shows dense breast tissue. So on the far right, as you can see, a lot of haziness in that mammogram. That's a woman that presents with dense breast tissue. On the far left, that's a more fatty replaced breast. Calcifications can sometimes be seen on mammography. And so, but 85% of the time, the calcifications are benign. Here in this picture, though, they do look more malignant. But again, if you get a report saying you have calcifications, just know that a biopsy will help determine if it's benign or not. This is an ultrasound of a breast cyst. What you should know is that breast cysts have less than 1% chance of cancer. And so usually that's something that we can watch. Usually surgical intervention is not needed. And this is an ultrasound to the far left. That's a very benign looking lesion. The borders are smooth. The mass is oval shaped. And on the right side, that's a picture of cancer. The margins are regular and the area is actually taller than it is wide. So family history is so important. So what we know is that when we look at first degree relatives, particularly if it's a mother, sister, or daughter, you have up to a 50% increase of getting breast cancer. There are other types of cancers that put you at risk as well, including prostate, ovarian, and colon cancer. If you have a very strong family history, this may indicate that you need to have genetic testing done. Patients who are high risk, they fit into a couple categories. It can either be based on your family history. It also can be based on a family member being diagnosed with breast or ovarian cancer at a young age. And then when you meet with a high risk professional that you will see, they will actually evaluate you and give you a number which will determine if you have a lifetime risk that puts you at risk of getting breast cancer. And if that number is over 20, then you're considered at high risk. You can also have genetic testing done, and if you have a known genetic mutation, you will be followed closely. If you've ever had a needle core biopsy done, which showed atypical cells or something known as lobular carcinoma in situ, then you'll be followed in a high-risk clinic. So there are so many genes now for breast cancer that we know about. The good thing is that we have more data now showing that there are only certain genes that will put you at risk of having breast cancer, and having a prophylactic mastectomy will actually decrease your risk. Those genes include the BRCA gene, the P10, the TP53, as well as a PALB2 mutation. So for high risk management, we oftentimes advise women to take certain medications which will lower their risk. Those drugs include tamoxifen, raloxifene, a drug called anastrozole, and another one called exemestane. When you're seen in a high-risk clinic, you'll be seen every 6 months. You'll get a breast exam, and every year you'll get a mammogram and possibly a breast MRI. As far as what's the most invasive part of lowering your risk is actually having surgery. If you meet certain criteria, then your surgeon may recommend you having a prophylactic mastectomy. Oftentimes, we try and keep all of the skin, including the nipple. If you have a generous bust size, we ask that you have a reduction lift formed initially, and then the mastectomies can be done with immediate reconstruction. So say, for instance, you are diagnosed with breast cancer. What should you ask your physician? You should know the type you have. The most common type is invasive ductal. Second to that is ductal carcinoma in situ. And thirdly, invasive lobular carcinoma. You should also ask your physician if the receptors are positive or negative. And those receptors include estrogen, progesterone, and something called HER2/neu. And you also should note the size of the tumor, as well as if there is any lymph node involvement. So when we're doing our monthly breast exams, which we should always do, and our monthly breast exam should be done a week before or a week after you have your menstrual cycle. We look for any breast lumps. We look for any retraction of the nipple. We look for any dimpling, and that looks like an orange peel. And we also look for nipple discharge, any skin changes, as well as redness or darkening of your breast. When we think about the size of any lumps that you may find in your breast, oftentimes women will say, I feel a pea-sized mass. So a pea-sized mass is about 1 centimeter. Once you get up to about 4 centimeters, that's the size of a walnut. So what are hormone receptors? If you can just imagine your fist being a breast cancer cell and your fingers are the receptors. Receptors are something that helps the cancer to grow, and we'll talk about the different types. So either women have either estrogen or progesterone positive cancer. They can also be triple positive, and triple positive cancer involves estrogen positivity, progesterone positivity, as well as HER2/neu positivity. Now, about up to 30% of African American women, they actually have triple negative breast cancer, and that's when the breast cancer cells don't exhibit any of those receptors, and they are estrogen negative, progesterone negative, and HER2/neu negative. So all women can get triple negative breast cancer, but as I stated, there's a larger percentage of African American women as well as Hispanic women who get triple negative breast cancer. And this is a famous person, Robin Roberts. We know she was diagnosed with triple negative breast cancer several years ago and has done well. So for triple negative breast cancer, what we know that the cancer cells do not express estrogen, progesterone, or HER2/neu. It can be associated with a BRCA mutation. It always requires chemotherapy. And please note, the surgical options remain the same. You can keep your breast intact if your breast surgeon agrees that it is feasible for you. But one thing about triple negative breast cancer is that there's a higher risk of recurrence in the first 1 to 3 years. A lot of women wonder about immunotherapy. Immunotherapy is given when you're HER2/neu positive. And what happens is that the targeted therapy will assist in boosting your immune system to combat the HER2/neu receptor. For all patients who are triple negative or HER2/neu positive, chemotherapy is often given. And in a lot of cases, chemotherapy is given before surgery, so that once you go through chemotherapy and have surgery, we're able to see the response of the breast cancer to the chemotherapy. So we're gonna go over some cases. This is just a 26-year-old. She comes in with a breast mass. Her great-grandmother had breast cancer. And so what we recommended for her is that she have a needle core biopsy, and it came back benign. And so we recommended that she actually not have surgery because it was not indicated. Her family history wasn't significant since it was a great-grandmother, and so we just recommended a 6-month ultrasound. This is a 46-year-old African-American female. She felt a lump in her breast 2 months ago. It's around 3 centimeters. Her sister had breast cancer at the age of 49, and her mom was diagnosed with colon cancer. So it came back with the most common type of breast cancer, invasive ductal, and it is triple negative. So we did genetic testing because she was young. As I stated earlier, that most women don't have a genetic mutation, so her genetic testing was negative. She saw a medical oncologist, and they recommended that she have chemotherapy up front in order to shrink the tumor. We talked about the surgical options, and what she was informed that a lumpectomy plus radiation therapy equals to having a mastectomy. And if she chose a mastectomy, then immediate reconstruction would be done. And we also recommended a sentinel lymph node biopsy because she had no obvious lymph node involvement on initial presentation. So the surgical options for most women include lumpectomy, which is termed breast conservation. Lumpectomies always go hand in hand with radiation. Skin sparing mastectomy, that's when we keep all of the skin and just remove the nipple and the areola. Nipple sparing is when we keep all of the skin and the nipple. Immediate reconstruction can be done before or after chemotherapy. And as I stated earlier, for early stage breast cancer, usually a lumpectomy plus radiation is suffice. So today, doing breast conservation or a lumpectomy, most times it depends on who your breast surgeon is. We try and perform an oncoplastic approach. And that way, we're able to hide the scar so you don't have any visible evidence that you've had breast surgery. The type of surgery that you choose does not eliminate the need for chemotherapy. Breast conservation is an option as well as mastectomy with immediate reconstruction. So this is case number 3. She's 40 years old. She noticed the mass over a year ago. It's now 4 centimeters. She has palpable lymph nodes under the arm, and she's complaining of lower back pain. Her sister was diagnosed at the age of 44, so this woman was known to be high risk. She had a mammogram and ultrasound, which confirmed the large lump in her breast, as well as enlarged lymph nodes. Genetic testing was done, and she was noted to be BRCA positive. So this is just an MRI of her spine, and it actually shows that the cancer has spread to her vertebral column. So the reason why I bring up, and this woman has stage 4 breast cancer, this shows the 5-year survival rates for early stage breast cancer. Stage 0 is the earliest you can get, and that's when you have ductal carcinoma in situ. Stage 4 is at the bottom of the screen, and as you can see, the 5-year survival rates are tremendously different. And so what you should know from this screen is that once you are stage 3 and above, you have a significant reduction in your 5-year survival rates. So for that patient, we did chemotherapy first. We did radiate her spine because she was BRCA positive. We did do bilateral mastectomies and a full lymph node dissection. And she did have immediate reconstruction, and we encourage her family members to be tested. Radiation, I want to go over briefly. We're fortunate at our hospital that we were the first in metropolitan Atlanta to provide intraoperative radiation therapy. And that's when you're over 50, you have hormone positive disease, and your lymph nodes are negative. We're actually able to do all of the surgery and the radiation in one day. There are other options for radiation treatment after lumpectomy, in which you can get radiation twice a day for 1 week. And in some cases, patients are recommended to have radiation for 3.5 weeks. And in the most severe cases, radiation is needed for 6 weeks. So for chemotherapy, what you should know is that most African-American women present with hormone-positive disease. Patients who have triple-negative breast cancer and HER2 positive disease will always require chemotherapy, but there's a significant portion of African-American women who actually will be treated with just taking a pill if they are hormone positive. Some stage 4 diseases, as well as early stage breast cancers, are now being treated with a pill. So just in summary, mammograms are needed starting at the age of 40. You should know your family history and act on it. See a high-risk provider. Lifestyle is important. Managing your weight, your diet, alcohol consumption, and exercise is important. Breast conservation is a very safe option for most women with early stage breast cancer. Most women do not have a genetic mutation when they're diagnosed with breast cancer. And if you choose to have a mastectomy, please note that in most cases, the risk of you getting a second breast cancer in the opposite breast is less than 6% in 20 years. Early stage counts. Breast cancer treatments have evolved and women now have more choices. Thank you again for this opportunity.
My name is Rena Wolf. Breast cancer has been a part of my family's dialogue for quite some time now, and I'd like to share some of the journey with you. The week of September 11th, 2001 was supposed to be filled with joy. My nephew David was becoming a bar mitzvah. Instead of happiness, it was horrific. Not only did our country suffer the biggest terrorist attack on U.S. soil, my youngest sister Lori was diagnosed with breast cancer. While the world was dealing with our country's tragedy, my husband Jackie said we had to focus our energy on Lori and getting her well. We were her warriors for 3.5 years of treatments and surgery. My sister Lori lost her battle. She was 50 years old. The following year, some ladies, relatively strangers, who I'm now proud to call my good friends, contacted me because they were going to do the Susan G. Komen 3-Day to remember 3 women aged 50 and younger who were active in the Jewish community and who had died from breast cancer. One of these honorees was my sister Lori. Our team became Angels for Angels, angels among us embracing angels around us. Over the years, our team has raised almost $1.5 million. I've raised as an individual over $100,000. We walk in honor of survivors and those we have lost to this disease, which strikes young and old in every nation around the world. I'm so proud to be part of a kindred group that's raised awareness and money to help fund research being done to eradicate this cancer. After 14 Komen 3-Day walks and many more than pink Komen Atlanta walks later, my team was planning to walk in Chicago. As we all know, 2020 has not gone as planned. The world's experiencing another tragedy, the coming of COVID-19. People started quarantining, and the 3-day walk did not happen. Once again, my family was struck with earth-shaking news. I was diagnosed with breast cancer on a semi-annual routine doctor appointment on a breast MRI. It really didn't register that this event that had become my passion was now going to be about my own survival. Everything regarding my treatments moved at a rapid pace, except for the agencies trying to figure out how to help the patients while not being able to physically see the patients. I started chemotherapy and it worked. I also made the decision to have genetic testing due to my Ashkenazi Jewish descent and the type of cancer I was diagnosed with. The results came in that I am BRCA1 positive. After discussions with my doctors, the only smart decision was to have invasive surgery to remove all the breast tissue. I'm so grateful to be able to say the words we want to hear. Cancer-free. I'm healing physically and spiritually. I've had so much support through my synagogue and friends, many of whom I made through the walks. I'm grateful to be the recipient of the expertise gained by all the research and knowledge funded by Komen. Our Angels for Angels team is thriving. I'm honored that many one-and-done angels have dusted off their sneakers and laced up their shoes to begin training for Chicago 2021. We'll be walking with my daughters, daughter-in-law, granddaughter, niece, and cousins. Many other Angels for Angels family and friends will be along the route cheering. A final note in honor of the esteemed Ruth Bader Ginsburg. Fight for the things you care about, but do it in a way that will lead others to join you. Thank you.
The late Andre Crouch wrote this song on his last project before he took his rest. It's called The Promise. I'll never leave you, never forsake you, no matter what you're going through. I have good news for you. I'll be with you always.
I'll never leave you,
Never forsake you.
never forsake you.
No matter.
No matter what you're going through,
I've got good news.
I have good news for you.
Hear the voice of the Lord.
I'll be with you
I'll be with you.
always.
And when
Troubles come,
and there's no place to run,
there's no other place to run.
just look to me and I'll be there. Just a whisper
Just a whisper
of a prayer.
of a prayer.
Sing, y'all.
I'll be with you always. I'll never leave you,
Never forsake you,
never
Lord.
forsake you.
No matter what
No matter what
you're going through,
going through,
I've got news for
I
you.
have good news for you.
I'll be with you.
I'll be with you
In stormy,
in stormy weather.
it is my pleasure.
It is my pleasure. I want to take care of all your needs.
Trust me.
Trust me,
I will be.
I'll be with you always.
And when
Troubles come,
and when troubles come
and
there's no other place,
to run.
just look
Look
to the hills.
and I'll be there.
That's where your help is coming from.
Just a whisper
Of a prayer.
of a prayer. I'll be with you.
Say never,
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 never.
never. I'll be with you.
Hear the voice of the Lord saying, will I ever leave your side?
Never,
Will I walk away?
never.
Will I turn a blind eye? I promise I will be.
I'll be with you.
The promise says, no matter.
No matter who you are,
No
no matter what you need, no matter what you're going through, I have good news for you. I'll be with you
always. He promised he'll be with you always. Be encouraged.
Man, what an incredible day of worship. I believe that God honored every song, every sacrifice, and every seed. I believe today made a difference, not just in your life, but in the lives of thousands of women who are battling and working through this disease. Thank you to the Susan G. Komen Foundation for having enough wisdom to give us this opportunity to worship in pink. Boy, y'all look good doing it too. Listen, let's take the next step. I need you to get involved. I need you to donate. I need you to volunteer. I need you to be aware. Get scanned. Get tested. Get that stuff off your chest. This is William Murphy. I'm excited about this partnership with the Komen Foundation. I'm excited about you becoming a part of the Worship in Pink team. It doesn't stop here. Today we worshiped in pink. In a few days, we're going to be walking in pink. I'm just excited as we continue to move forward. And let me say this in closing. Get your seed in the ground. Get your service record together, because this dis-ease is soon to be over. You cannot worship God and God not respond. I love you. I'm praying for you. And in closing, I want to remind you that there was a woman, I believe it's in the book of Mark chapter 5, who had an issue. And as she began to worship, the scripture says she got the attention of Jesus. Jesus turns around in the crowd and he says to this woman with this issue, your faith has made you whole. Go. I'll see you next time. Your faith has made you whole. What an incredible day. I love you and I'm praying for you.